This presentation is going to talk about the concept of analgesia, the importance of controlling pain when we are doing procedures in veterinary medicine, and we are also going to talk about the different drugs that we can use in order to provide analgesia in animals. Analgesics are defined as medications that relieve pain without causing loss of consciousness. So basically, we define pain as an unpleasant sensory and emotional experience associated with actual or potential tissue damage. Regarding pain, of course, we have to understand what is nociception. So nociception is the pain that results from stimulation of the sensory nerve fibers called nociceptors. Nociceptors are receptors that transmit pain signals from various body regions to the spinal cord and the brain. The diagram shows the concept of the pain pathway, and the pain pathway starts with the noxious stimuli. It can be mechanical, thermal, chemical, inflammatory, or tissue damage. So the noxious stimuli are transduced by unencapsulated nerve endings or nociceptors that are present in the surface of the body. And there are four processes that are involved in the pain pathway. We have the transduction, the transmission, the perception of the brain, and the modulation. So under the transduction, the injured tissue will release chemicals that propagate pain message. And after that, the pain message or the pain impulse will be transmitted from the spinal cord to the brain. And after that, the pain will be perceived by the brain. The impulse will be again transmitted to the spinal cord, and the neurons from the brain stem will release neurotransmitters that block the pain impulse. So as you can see here, at this level, we have the presence of the nociceptors and the opioid receptor. The same is true at this level. No, there is also the presence of the opioid receptors in the neurons and the nociceptors. A nociception, that is the detection by the nervous system for potential for or actual tissue injury. And this physiological response will protect the animal from painful or noxious stimuli. Pain can also be classified as either physiologic pain or pathological pain. So when we say physiologic pain, that comes from that is due to a little or no tissue injury that is brought about now by little or no tissue injury. It is also known as the ouch pain. For the pathologic pain that follows tissue injury, and it can also be classified as either acute or chronic. Pathologic pain can also be classified according to different means. So the first classification is based on the mechanism of the pain. So that can be inflammatory, neuropathic, cancer, or idiopathic. It can also be classified according to its origins. It can be visceral or somatic. So when we say visceral, it's related to the internal organs of the body, particularly at the midline of the body. So unlike the somatic pain, of course, somatic pain occurs in the tissues such as the muscle, the skin, or the joints. The visceral pain is often vague, happens every so often, and feels like a deep ache or pressure. So the visceral pain is more of the deep, deep pain because it involves internal organ, but the somatic pain is more of the superficial pain. For the classification based on the severity of the pain, of course, we have the mild pain, the moderate, and the severe. So again, this is the pain pathway. So there are four processes or steps that are involved in the pain pathway. We have the transduction, transmission, modulation, and the perception. So in the transduction process, it is where the transformation of the stimuli, particularly noxious stimuli, into sensory electrical signals come into play. After that, the pain impulse will be transmitted uh, along the spinal cord, from the neurons to the spinal cord, and it will be modulated. So the impulses will be either amplified or suppressed. And again, we have the perception wherein the impulses are transmitted to the brain where they are processed and recognized. This diagram shows the different classes of analgesic drugs that work at different locations in the pain pathway. So again, the pain pathway includes our transduction, our transmission, our modulation, and the perception. So With multimodal analgesia, a synergistic response can be achieved by targeting these different locations. So when we say multimodal analgesia, that is a mechanism whereby we are going to administer, a different types of analgesia and a different types of analgesic in order to achieve efficient analgesia. So at the level of the transduction process, the first phase of the pain pathway, particularly at the nociceptors, this pathway can be inhibited by local anesthetics or opioids and or NSAIDs or non-steroidal anti-inflammatory drugs. In the transmission pathway, transmission particularly along the nerve fibers, the pain pathway or the pain impulse, sensory impulse can be inhibited by local anesthetics and our alpha-2 agonist. So of course, alpha-2 agonist is also an analgesic. At the level of spinal cord, wherein sensitization and modulation is being it take place, this can be inhibited by opioids, NSAIDs, non-steroidal anti-inflammatory drug, and NMDA antagonists. So this is our ketamine, our dissociative anesthetics. We also have our alpha-2 agonists and our local anesthetics. For the perception process, this can be inhibited by general anesthetics, opioids, and alpha-2 agonists. It's another diagram of the pain pathway, and the interventions that can modulate the activity at each point. Again, this is highlights the value of multimodal or balanced anesthesia in post-operative pain treatment. So these are again the different pathways. So at the level of the skin, particularly at the peripheral nociceptors, we can use local anesthetics and NSAIDs, anti-inflammatory drugs, in order to inhibit the pain transmission pathway. At the level of the peripheral nerves, where transmission occurs, we have the local anesthetics. At the level of the spinal cord, we have the local anesthetics, the opioids, alpha-2 agonists, and at the level of the brain, where perception of the pain is being take place, we have the opioids and the alpha-2 agonist. So we have not mentioned here, the NMDA receptor antagonist, which of course acts at the level of the spinal cord. Examples of this are our opioids and our ketamine. You can notice in the pain pathway, each step has a different receptors that are involved in the transmission of the pain impulse. So drugs can be selected that will target specific receptors and block a specific step, as we have shown earlier. Of course, this is important for multimodal therapy because in multimodal therapy, we are targeting two or more of the receptors in order for analgesia to be more efficient. Why do we need to provide an efficient analgesia when we are going to conduct a procedure in animals? And why is it that pain is important in the health as well as the well-being of the animal? So this is a list of the consequences that can happen to the animal if we are not going to treat properly or not going to control pain before we are going to conduct certain procedures. So these are the consequences of the untreated pain in animals. So an untreated pain can result to catabolism and wasting. So when we say catabolism, of course, that is the breakdown or the degradation of the degradative metabolism or the release of energy in the animal. When we say wasting, of course, that includes the animal being emaciated, and of course in terms of the bulk of the animal, physical bulk, so it reduces or it shrinks. So of course that is not good, to the animal. Of course, another consequence of an untreated pain is that it can cause a suppression of the immune system, and of course the immune system is very important in order to fight the pathogens, the infectious pathogens in the body. And of course it is important to remain healthy for the animal. It can also delay wound healing as well as promote inflammation. And of course, now when we are conducting surgery, what we aim for is to hasten the healing process in order for the animal to recover efficiently. We also have the anesthetic risk and increased anesthesia doses. Of course, when we do not provide analgesia to the animal, we need to also increase the dose of other anesthetics, and that can cause, for example, respiratory depression, since most of the anesthetics can cause depression not only of the respiratory but also of the cardiovascular. Now, as well as it can also cause hypothermia. Of course, the most important thing here is that when we are not going to treat pain or when we are not going to provide analgesia, of course, that is very inhumane because it can cause the suffering of the patient. We have the concept of primary hyperalgesia. So this is also referred to as peripheral hypersensitivity. This happens or this results from tissue damage and constant stimulation of the nerves. So when there is constant stimulation to the nerves, the area close to the site of tissue injury becomes painful when stimulated, even with non-noxious stimuli. When we say hyperalgesia, that is increased sensitivity to pain, and we also have the secondary hyperalgesia concept. So this is also known as the CNS hypersensitivity or wind-up pain, and the area of hypersensitivity is considered to be further away from the site of tissue injury. This results from constant stimulation of the spinal cord neurons. And in this case, the neurons become hyperexcitable and sensitive. So when you are going to expose an animal to even a slight stimulation with pain, so it can feel pain in a more severe form, and that is because of the CNS hypersensitivity or the wind-up pain. This happens, so for example, when you are not going to administer a pre-anesthetic, particularly an analgesic, to a patient before you're going to conduct, for example, a surgery. So, of course, the recovery of the patient from the anesthesia would be much more not good, no, because you have not provided the animal um, analgesic, no, prior to the surgery. So even if you have administered an anesthetic, but of course not all anesthetics are potent analgesics. They are not really intended to provide analgesia. So when you have not provided a proper analgesia to the animal, so it can result to wind up pain. The animal becomes more hypersensitive to exposure, to even exposure to pain uh, post-operatively. This diagram depicts now the pain sensitization. Um, the y-axis represents the intensity of the pain, of course, from 0 to 10. So this is the most severe form of pain, no, the severe degree of pain. And the x-axis represents the intensity of the stimulus. So again, we have here, no, the red line here represents the hyperalgesia. When we say hyperalgesia, that is the increased sensitivity to pain. And we also have here, the curve for the normal pain response that is represented by the blue line. So the noxious stimuli, can sensitize the nervous system response to subsequent stimuli. So, of course, when we say noxious, that is those stimuli that are damaging or that are injurious, not to the animal. And when you expose the animal to a noxious stimuli, such as pain, it can sensitize. It can make the nervous system more sensitive to the subsequent stimuli or subsequent exposure to noxious stimuli. So as you can see here, we have here the normal pain response. It's a function of the stimulus intensity that is depicted by the curve at the right. So this is the normal pain response, depicted at the blue line. So as you can see here, even if we have a strong, um, as you can see here, even if we have a strong stimuli, the animal is not experiencing pain totally. However, when a traumatic injury, so we have here an injury when we are going to expose the animal to a traumatic injury, it can shift the curve to the left. Now then noxious stimuli becomes more painful. So that is known as hyperalgesia. So the animal develops hyperalgesia when you are going to expose them to um, a traumatic injury. And typically painless stimuli are experienced as pain. So when you are going to constantly expose the animal to constant pain due to a noxious stimuli, and it can result to hyperalgesia or increased sensitivity to pain up to the point that uh, typically yung mga painless stimuli are experienced as pain already. So as you can see here, even if you do not expose the animal to us, even if the stimuli is not as severe as that of the stimuli before, no, so the animal still experiences pain or allodynia because of this constant exposure to pain. So that is also the concept when we are not going to administer a an analgesic, no, if we are not going to provide the multimodal therapy in the analgesia. So it can also result to exposure to constant pain, not that will be that will serve as a traumatic injury to the patient, and it can result, no, to the development of hyperalgesia or increased sensitivity to pain and allodynia. And allodynia meaning that even if you are exposing the animal, no, to painless stimuli, the animal can still feel or experience pain. These are the physiological changes that are caused by pain in the body. So, of course, it can result to changes in the neuroendocrine system, as well as the stimulation of the sympathetic nervous system. For the neuroendocrine changes, it can result in catabolic state. Of course, this is the degradative breakdown or the release of energy by the animal, and wasting or emaciation, or the overall loss of mass, now both the fat and the muscle. And specific neuroendocrine changes include the release of adrenocorticotropic hormone, no, and elevated cortisol. So cortisol represents the stress hormone. And we also have norepinephrine and epinephrine. There is also decrease in insulin level. Of course, insulin is important, no, for the utilization of sugar in the body. For the sympathetic stimulation, so pain can also stimulate the sympathetic nervous system that can result in cardiac arrhythmias. So of course, sympathetic stimulation will result in vasoconstriction. Of course, it can also increase the heart rate. It can increase the myocardial work, of course, and increase the myocardial oxygen consumption. So pain elicits a stress response, and the stress-related pain results in fight or flight physiological response. As you can notice, when there is elevation in the pain level in the body, so there is also an increase in the catecholamines, the norepinephrine and the epinephrine, as well as the stress hormone cortisol. We also have the concept of the preemptive analgesia. So when we say preemptive analgesia, that is the administration of pain medication before the pain occurs. It commonly involves adding analgesic to premedication prior to anesthesia. So of course, when we say analgesic, so an example of this are the opioids, the one that we usually use during certain procedures in animals. It reduces the overall requirement for analgesia and duration of administration. So again, in balanced anesthesia, this is also under the balanced anesthesia because we use again multimodal therapy in order to decrease the the dose of the drug, the dose of the anesthetic, the dose of the concurrent drug that will be used for anesthesia. And it also prevents wind up pain. And when we say wind up, that is the increase in pain intensity over time when a given stimulus is delivered repeatedly above a critical rate. So again, this is due to the again, no, the concept of our secondary hyperalgesia when we are going to, to expose the animal to repeated traumatic injury or noxious stimuli. So the spinal cord can sense that stimuli, and the spinal cord can be more hypersensitive to the exposure to uh, concurrent or repeated exposure to noxious stimuli. Um, or the behavioral responses that are exhibited by the animals to pain. So the behavioral responses will vary according to the species of the animal, the age of the animal, the breed, as well as the temperament of the animal. Usually, the young patients are less tolerant to pain than the older patients, and the cattle are considered to be very stoic to pain. When we say stoic, that is tolerant or enduring. No? So cattle are often described as stoic, meaning they do not display obvious pain behavior. Large dog breeds also are more stoic or more tolerant to pain than small toy breeds. And for cats, they usually exhibit hiding as a response to pain. For dogs, they seek honor comfort. And for herd animals, they separate themselves from the other animals. Again, the behavioral responses could also vary according to the nature, the duration of pain, as well as the severity of the pain. And it also vary according to the presence or the absence of humans. Also have here, some physical evidence of pain according to its nature or origin of the pain. So when there is arthritic pain, for example, the animal can exhibit changes in the gait and level of activity. When in the presence of a thoracic or abdominal pain, so the animal can exhibit reluctance to lie down or constantly shifting position. Other physical evidence of pain in animals. So when the animal is vocalizing, when there is vocalization, so it could provide no indication that the animal is in pain. So there are different types of vocalization in animals, so depending on the species of the animal. We also have the emergence delirium in animals. So that usually happens as an immediate post-operative vocalization. So for example, after the operation. There are also changes in facial expressions, appearance, and attitude of the animal, as evidenced by pain. So how do we assess the pain in animals? So we can do that by verbal rating scales. We also have the simple descriptive, numeric rating, visual analog, and the comprehensive scales. Here, the verbal rating scales and simple descriptive scales to indicate pain in animals. So we have here, for example, we can rate the pain as no pain, mild, moderate, or severe, depending on our own subjective description and own observation of the pain. Of course, we have here the basis for our score that we are going to indicate in our rating scale, no, for our descriptive scale. This is in cats, and we have here our description of pain. So, for example, when we score 0, that indicates that the animal has no pain. For 1, there is some pain, but there are no overt signs of discomfort to the animal. For a score of 3, for example, there is the severe pain. There are obvious signs of persistent discomfort, which are made worse by firm pressure. So again, these are applied. No, these are usually applied in cats. This is the form that we are going to fill up now when we are going to assess the pain in animals. So this is a comprehensive scale to assess pain in animals. So this includes the signs of pain, the different signs of pain, physical signs of pain. We also have the classification of pain and the anatomical location of pain in the animal. So we have here the ventral position, dorsal, and right left part, and you write here your comment. We also have here the visual analog scale and the pain therapy that you have employed, as well as the visual analog scale when you do analgesia and you administer an analgesic. So this is a guide in assessing the response of the animal to therapy with pain. And for assessing the response of the animal to the therapy, we can do that by comparing, for example, the acute surgical pain versus the chronic pain. And we can do the assessment hourly or monthly, depending on, of course, the condition. So, of course, when it is acute pain, surgical pain, the assessment should be done hourly versus the chronic pain, it can be done monthly. With effective analgesia, of course, we can observe the pain-associated behaviors to recede. For example, the appetite, improvement in the appetite, grooming, body position or posture, as well as improved interaction with people. With effective analgesia, of course, we can observe a decrease in the pain assessment scores. The perioperative pain management, of course, we have the preemptive analgesia. So we already have defined this. No? The preemptive analgesia begins in the preoperative period with premedication. It may be administered as part of the anesthetic premedication. And one of the example here is the application of the transdermal fentanyl patch. Of course, that is in dogs. And we also have the non-steroidal anti-inflammatory drugs, primarily in large animals. We also have the multimodal therapy. Again, this is the use of more than one drug to control pain. And this covers multiple receptors and MOA. And it also reduces the dose of the individual drugs and the anesthetic agent. Again, this is a balance, no? Similar to the balance anesthesia. Again, it covers multiple receptors. So we have shown earlier the pain pathway. So we'll show that now in the next slide. Of our multimodal therapy. So in the multimodal therapy, we use a group of drugs, not only one drug, no, in order to provide efficient analgesia to the animal. So it covers again different types of receptors, no, that we cover, as well as different pathways in the pain pathway of the animal. So for example, at the level of the nociceptors, peripheral nociceptors, where noxious stimuli are being transducted, we can use local anesthetics. Now we have our NSAIDs, and of course these are the COX-2 inhibitor, no, or NSAIDs. And we also have the anti-inflammatory agents, other anti-inflammatory agents, ICE also. For the transmission pathway, of course, we have here also the receptors, no, the nociceptors, and this can be inhibited by the local anesthetics. For the spinal cord, at the level of the spinal cord, we also have the local anesthetics, our opioids, our alpha-2 agonist, and our NMDA antagonist. So, of course, the NMDA antagonists, such as the ketamine and other opioids, will act by blocking, for example, the NMDA receptors at this particular level. At the level of the CNS of the brain, we have the opioids, alpha-2 agonists, centrally acting analgesics, for example, acetaminophen or paracetamol, and other anti-inflammatory agents. Important to note that analgesia is needed at every stage of hospitalization and treatment. So, of course, we should apply analgesia at the pre-anesthetic period, of course, at the surgical period, immediately post-operative period, the remainder of the hospital stay, as well as at home. How do we choose a drug for analgesia? So, of course, the choice of the drug will depend on the severity and the type of pain. Now, whether it is a chronic pain, whether it is an acute pain, a surgical pain, visceral or somatic pain, and of course, according to the severity. We also have the patient's general condition, as well as the route of delivery.